Hi, how are you? My name is Dr. Salvatore Mulé. I'm the medical director of my InstaDoc of Howell, part of the larger family of Central Jersey Urgent Care. So how do we talk to our children? It's quite difficult. Things are forever changing. Things are what could have been said to you 2 weeks ago may not hold true. And that's part of the fluid, positive movement of learning more and more about COVID-19. So how do we explain this complex thing to our children? Well, first thing is to find out already what our children know. They might have an understanding of what they think the understanding is. So it's important to really ask your children, what do you know about COVID-19? And have them have that opportunity to explain to you what they think COVID-19 is. Speak calmly, reassure, and give them the space to really voice their fears. It's okay to be afraid. We use the knowledge and the tools that we have today in order to continue with our everyday life as it is today. But it's okay to say you're scared and allow them to do so. Telling your children that you may not know something, but using that point to together look up different information about COVID-19, using, of course, reputable resources like the CDC, in order to educate yourself and also in turn educate your children about the facts about COVID-19. And like I said, it's something that's forever changing and may take more than one session to be able to figure out. It's important to talk about what's happening. Children really pick up a lot from their environment, sometimes especially because of maybe some misinformation of someone who doesn't really know about COVID-19 or has heard facts through hearsay or even in our media. Sometimes things can be misconstrued or misunderstood. So it's important to always use the facts. So putting news stories and things like that into context for children, using their words and verbiage that they do understand, also eliminates that fear. A lot of times kids really are worried about themselves. They're worried about their friends and they're worried about their family. So giving them that reassurance and having those conversations really is important. We live in a time that while children don't necessarily have the complications of COVID-19 that we see in adults, they have a complication that sometimes is not well really spoken about. And that's the anxiety and depression that children feel from the COVID-19 pandemic. So it's very important that as parents, as family members, as community members, we really keep an eye on the behavior of our children. So keep the conversation going. It's not a one-time conversation. It will be always evolving, and there needs to be an open door for your children to feel comfortable to have that conversation with you, maybe after hearing something that was new on the news and having a worry or fear. We will overcome COVID-19. It will take time. It will take patience. It will take us working together as communities, but we will overcome it. So I wish you the best. Stay well, be well.